Here is the liver. It situated in the upper part of the abdomen, and it remains in the right hypochondrium, in the epigastric, in the left hypogastrium, and in the right lumbar region. This is the extent of the liver. Liver is the largest gland of the body. The weight might be around 1.5 kilogram, and it is remain in the upper part of the abdomen. So sometime it might be asked that how this heavy structure is remained in the upper part of the abdomen. The answer is that it is here. It is connected with the here you can see the inferior vena cava. From the inferior vena cava there are hepatic veins that comes out from the inferior vena cava and enters into the liver. Here we see the inferior vena cava. From here the hepatic veins enter into the liver substance, and it acts as a holder. So it remains in this upper part. And another part is that in this part of the body, in the abdomen, there are many viscera underneath the liver. These viscera pulls the liver in the position, and there are some ligaments around the liver. Here you can see there is a ligament. There is a ligament. This is the liver, and liver has here is the stomach, and this is the diaphragm, and this is the liver, and liver has two lobes. This is the left lobe, and this is the right lobe. In between these two lobes we see there is a ligament. This is known as the falciform ligament, and this falciform ligament is a large ligament. It is attached here. You can see this is the diaphragm, and in this side this is attached with the anterior abdominal wall that is cut here. At the lower end of this falciform ligament we can see that there is another ligament that is known as the round ligament of the liver, or it is the ligamentum teres hepatis. So this is a ligament, and there are some other ligaments in the posterior surface of the liver. Here we can see the posterior surface, and there are some ligaments. These are the support of the liver that hold the liver in this upper position in the abdomen. And liver is two lobes. This is the right lobe, and this is the left lobe. And the right lobe, there are two another lobes. Here is the caudate lobe, and here is the quadrate lobe. So if we count the total number of the lobe, there is the left lobe, there is the right lobe. Right lobe has two another lobes, caudate lobe and the quadrate lobe. So these are the lobes of the liver, and the liver has some surfaces. Here we can see this is the anterior surface, and there is the posterior surface. Here is the superior surface, and here is the inferior surface, and here is the right lateral surface. All five surfaces of the liver. And the borders of the liver are blunt. They are rounded borders, but the inferior border, it is very sharp border, and it is notched in its course. Here we see there is a notch that divides the right and left lobe through the falciform ligament, and here is the ligamentum teres. And there is another notch through where we can see the gallbladder. The anterior surface is very shiny and smooth, and it is covered with the peritoneum. And the posterior surface, the area, all the area is not covered with the peritoneum. The area in between the inferior vena cava and the right triangular ligament, this area is attached with the diaphragm superiorly. So there is no peritoneum in between this liver and the diaphragm. So this is known as the bare area. The bare, because there is no peritoneum, and where there is the inferior vena cava there is no peritoneum, and where there is the gallbladder there is also no peritoneum. So these areas are also known as the bare areas. And here we see there is an important structure through which the ducts enters into the liver and exits from the liver. This is known as the port of the liver. That means porta hepatis. Through this porta hepatis, we can see there is an artery, that is the hepatic artery, that enters into the liver. There is the portal vein that enters into the liver. There are some nerves that enter into the liver through this porta hepatis, and there is the bile duct. Bile duct. The liver secretes the bile that passes through this duct, that is known as the bile duct, and it is stored in the gallbladder. So the exit of the porta hepatis is the bile duct. So the structures that are within the porta hepatis are the vein, artery, nerve, and the bile ducts. And the location of this port in between the caudate and quadrate lobe. Here is the caudate and quadrate lobe, and it is in between the inferior vena cava and the ligamentum venosum. There are some ligaments in the liver. You have to orient with these ligaments. There are the ligament here. You can see the falciform ligament, and this is the coronary ligament, and this is the left triangular. This is the right triangular ligament, and here is the ligamentum venosum. Here is the ligamentum venosum. These are the ligaments. And the ligamentum venosum and the ligamentum teres hepatis, these are the structures that the remnant of the embryonic structure. Here we can see the fetal circulation. During the fetal life, the fetus gets its nutrient and the oxygen from the mother through the umbilical vein. The umbilical vein carries the oxygenated blood, and this umbilical vein comes in front of the liver. Here we have seen where the ligamentum teres hepatis is there. So this umbilical vein, the remnant of the umbilical vein, acts as the ligamentum teres hepatis. Here, can you correlate this? Here is the ligamentum teres hepatis, and here is the umbilical vein. After the birth, this umbilical vein disappears and remain as the remnant, and it is known as the ligamentum teres hepatis. And it is written in here, the ligamentum teres hepatis. So this umbilical vein here. Through this umbilical vein, the oxygenated blood comes to this liver. And in the fetal abdominal part, from the fetal abdominal part, the deoxygenated blood comes to the liver through the porta hepatis. And finally, all this blood comes into the inferior vena cava. And all the oxygenated blood that comes to the liver, from here, the oxygenated part of the blood enters into the inferior vena cava through a connection. This connection is known as the ductus venosus. After the birth, this ductus venosus disappears and remain as the ligament in the posterior surface of the liver as the ligamentum venosum. This is the ligamentum venosum. This is the remnant of this ductus venosus. It disappears after birth, as because after birth the blood comes from the abdominal part through the portal vein, then enters into the inferior vena cava. This channel will remain, but the channel through which the oxygenated blood comes from the umbilical vein, this will disappear, and finally this part will also disappear, and this part, the umbilical vein remnant, named as the ligamentum teres hepatis, and this part of the ductus venosus act as the ligamentum venosum in this adult liver. So these are the ligaments of the liver. I think you have a clear insight about these ligaments. And the other parts of the liver, we have mentioned all the things.